Hi everyone. In this video, I'm going to be talking about the fundamentals of being an entrepreneur. What we're going to cover is the difference between the technician mindset versus the entrepreneurial mindset and why you need both. We'll be talking about the difference between just-in-time information versus just-in-case information. And we'll be talking about your minimum viable product, what that is, why you need one, and how you set that up for your private practice. So first of all, the technician mindset versus the entrepreneurial mindset. Currently, you are a technician. Now, you are a very highly trained technician. You have a lot of expertise. You have training in empathy and professionalism and ethics and all this stuff. But really, what your skill set is doing something within a certain area of expertise. To be effective at private practice, you of course need to be a good technician, a good physician. You also need to learn how to function as an entrepreneur. And people who show up with private practice thinking they can just be doctors and show up and that's good enough. Yeah, I mean, you can do it because there's such a high demand for psychiatrists, but that's not what we're here to do. We're here to also learn how to be entrepreneurs so we can have highly successful, highly lucrative, highly rewarding practices that have a huge positive impact on our patients. So what is the technician? The technician focuses on specific hands-on tasks that must be performed as part of the day-to-day aspects of a business. These are terms that aren't specific to medicine. They're specific to any business. So like an accountant, and these are roles, it's not like one person has to be the technician. That's what we're talking about, is you have to be able to fulfill both roles. But in an accounting practice, the role of the person who sits there and crunches the numbers and does people's taxes is the technician. Now, the technician is conservative and safe. In the case of medicine, follows the evidence, but has trouble deviating from the pack. And you've probably experienced this in residency or if you work in academic medicine. As a technician, it's really hard to do something different than the status quo. Now, the technician possesses the practical knowledge and discipline required for the business, in this case, the practice of medicine. And when you are embodying the role of the technician, you are thinking, what should I do for this patient? What medication should I prescribe at what dose? What kind of therapy should I do? Am I being responsible, professional, ethical? So you have to be able to do all this, of course. Now, the entrepreneur, though, has a different role. The entrepreneur focuses on driving the business into the future. The entrepreneur is willing to take risks, be flexible, is hustling. I mean, hustling in a good sense, not like a negative connotation, but like, how do I grow? How do I do something new? How do I push the status quo? How do I grow my field into the future? The entrepreneur is value-oriented and driven to achieve success. The entrepreneur wants something more than just to show up at a job and leave the job every day. That's why you're in this program, because you could have done that and you could have had a fine living and had a fine life, but that's not what you wanted, right? You wanted the things, the benefits that come with being an entrepreneur, freedom, autonomy, and having really no ceiling of what you can accomplish. The entrepreneur thinks, how do I optimize my systems? How do I grow? How do I want my career to look in 1 year, 3 years, 5 years? How do I create value? In private practice, how much money you make is directly related to, equals how much value you create for your patients. This is opposed to your job. Like if you have a job in psychiatry, which you have a salary and you get paid that same amount, regardless of whether you do a mediocre job or an amazing job. Maybe you get like a promotion every year or every couple of years. If you're at Kaiser, you make partner, or if you're in academics, you get a grant or whatever. Like there are certain incremental growth that happens in any job. In private practice, there is no ceiling. You can have exponential growth as long as you are willing and able to become so good at what you do, and not just the technicalities of practicing medicine, but the entrepreneurial mindset and understanding that the more you benefit your patients, the more money you can make, the more impact you can have. There's no ceiling. There's no ceiling to however you define success: money, freedom, autonomy. Maybe you want to only work part-time so you can focus on your family or take vacations or whatever it is. You can do whatever you want if you are really, really good. This concept of the technician versus the entrepreneurial mindset comes from this book, The E-Myth Revisited. I highly recommend it. It's one of the most fundamental business books that everyone recommends. You don't have to read it cover to cover, but you can kind of read the first couple chapters and get the basic gist of it. Now, let's shift to talking about just-in-time versus just-in-case information. Now, just-in-case information is what you are used to probably in the practice of medicine, which is this trap that people get stuck in fields like ours, where we tend to be conservative and not want to deviate from the pack and be, for good reason, value professionalism and value not making a mistake, because mistakes can have high consequences in the practice of medicine. But people get stuck in this mindset of like, I'm not ready yet. Let me just get another fellowship, get another degree, and then I'll start my integrative psychiatry practice. Let me get an MBA first, and then I'll do it, or do another training or whatever. Or I can't start my practice now. I got to incorporate. I got to get my office, got to get the perfect office furniture, got to get the perfect intake forms, got to talk to a lawyer, get the perfect website, hire some, get some $5,000 website, talk to an accountant, and then I can see my first patient. This is all a trap because it prevents you from doing the one thing that's important in private practice, which is getting a patient in the door and seeing a patient and having them pay you money for your services. You're used to seeing patients. I mean, you in residency, and if you had a job, you've seen a lot of patients. But what you are not used to probably is someone paying you money, a lot of money, for the service you provide. And it can feel very uncomfortable. And all these other things are just a way to avoid doing what's uncomfortable. Just-in-time information, you have to, this is the entrepreneurial mindset. This is what you have to shift toward, which is instead of studying a bunch of stuff and reading a ton of books and doing all these things just in case you need the information, you wait until you really need the information and you get the information just in time. Now, this is a story for me. One of my first patients I saw in private practice had trichotillomania. She called me, we did the initial phone call before she scheduled the appointment. And she said, here's my problem. I have trichotillomania. Do you have experience with that? I'm like, yeah, definitely. Totally do. So we scheduled the appointment for a couple days out. And then I researched trichotillomania for the next 3 days. I was also very out of practice with medicine in general at this point because I might have told this story elsewhere. You might have already heard it, but I started my private practice when I had been in chemo for like 3 years. And so I had to take 3-4 years off of residency while I got treatment for cancer. So I had all these insecurities. Whatever insecurities you think you have, multiply that by 100, because I couldn't even remember how to prescribe like Lexapro. I was like, what's the starting dose of Lexapro? Basics, I couldn't remember. But I didn't just sit there and obsess and try to study everything. I was like, well, I have a patient tomorrow with this thing. I'll learn this thing now. I also, when I saw my first patient, I didn't even have a way to bill them. I saw the patient, and then after the fact, I was like, shit, I got to get a business bank account. Actually, I didn't even have a business bank account. I set up a merchant account. I just had to deposit money into my personal account, and I set up my business account later because it's like, I just see the patient and then get the systems figured out after. Now, you just in time information is I just saw a patient with this particular issue and I wasn't sure how to treat them. So I said, you know what, I'm not sure. Let me research this and get back to you. And then you read a book, you get case supervision on that particular topic at that point. Doing it this way, let's be honest, it's a little bit more anxiety provoking, and you probably have problems with not being perfect if you're a doctor. I mean, we all kind of do a little bit. But you will grow faster, and you can still practice very responsibly doing it this way. If you trying to be perfect out of the gate, you're hamstringing yourself and you won't grow. Let's talk about minimum viable product. This is a concept that comes out of the startup world, specifically the software startup world. So this is the definition of a minimum viable product. A minimum viable product, or MVP, is the early version of a product, such as a SaaS, software as a service application, that is designed to ensure that product vision and strategy are aligned with market needs. Typically, an MVP delivers just enough functionality and value to appeal to early adopters and other innovators. The most important thing here is aligned with market needs. If you create a whole detailed practice and systems and USP, unique selling proposition, and complicated website and all this stuff, and you haven't seen a patient, you have no idea if what you're selling is what patients actually want. And the startup world knows this very well. Doctors don't understand this. But if you understand this, you understand that it's actually a waste of your time to try to be perfect out of the gate. Instead, you just start and you see what patients want, and then you respond to that, and you build based on that. So instead of trying to learn everything, you realize, like, this is what I realized. Oh, half of the patients coming in my door have generalized anxiety disorder. It's just so common, and most of my patients early on were women between 20 and 40 with generalized anxiety disorder. So instead of trying to learn every detail about integrative medicine for every diagnosis right off the bat, I just got to be really good at generalized anxiety disorder, and then I learned the rest of this stuff more slowly over time. This concept comes, I believe, feel free to correct me if I'm wrong, I think this term was coined from this book, The Lean Startup, which you don't have to read. It's really more specific to the startup world, to the software startup world. But if you're really interested in business, it's a great book. I've read it. Now, what is a minimum viable product in private practice? Let me just be very concrete. It's the basic office admin setup. Like, to see your first patient, you do need a phone number. Unfortunately, you need a fax number because, I don't know, pharmacies think we're in 1995 still, and they will fax you things and people will fax you things. So you can use an electronic faxing service like HelloFax or SR Fax, but you do need a fax number. I do recommend right off the gate using an EHR. You do not have to. I actually did not have an EHR for the first couple of months because I wasn't sure what the best one was. But I will tell you what the best one is in a future video in this module. It's Luminello. And so in my case, I did paper notes. And then when I figured out what the best one was, I just scanned my paper notes, uploaded them to Luminello. But it's really much easier if you right out the gate, just use Luminello. You really do want e-prescribing. I did not have e-prescribing right out of the gate, again, because I wasn't sure what the best one to use was. But now everyone's doing tele-psych, and you're going to be way in the past if you're mailing people prescriptions or trying to call in prescriptions. It's a waste of your time. So you want that out of the gate. If you want to have in person, do not get your own office. I mean, sometimes you can. I actually did, but that's a whole separate story. Because someone gave me a really good deal and they let me use their office full time, but I just was paying for 2 days a week. If you can do something like that, great. But generally, you don't want to have to go through all the research involved in finding an office and signing a lease, and you're committed 5 years, and then you got to build out the office and furnish it and cost thousands of dollars. Just borrow or sublet someone's office. You literally only need 2 chairs and a desk in that office. That's the way my office was furnished for probably 3 months before I got any other, like little lamps and side tables and stuff. That's all the optional though, because now everyone does telepsych. So the whole office thing is optional. You just use a telepsych platform if you want to start with video only. And you need some way to bill people. Again, I did not have a way to bill people before I saw my first patient, but after I saw my first patient, I needed it because you want to get paid. And you need malpractice insurance, obviously. Now, what you don't need right away, and people get really caught up in this stuff, as a distraction is incorporation, a website. You do want a website at some point, but you don't need one to see your first patient. You definitely don't need to talk to a lawyer or an accountant. You talk to an accountant at the end of the year when you're doing your taxes, or in March, or I mean, you don't want to wait till March. It's due in April. But like that, you don't do it just in case, you do it just in time. Any of this stuff that is distracting you from your task, which is getting a patient in the door and having them pay you for your services. Do not try to be perfect right out of the gate. Like I said, this is not only a recipe for unnecessary anxiety, but it's a waste of your time, and it will make you grow slowly. You will inevitably learn the wrong information or information that's not relevant as opposed to the high yield information, and it will be frustrating. The idea, this again is the entrepreneurial mindset, is iteration, not perfection. You just start, and it's a little chaotic and it's a little stressful, but you just manage that stress and anxiety you have, and then you see where are the problems. Like, oh God, I'm wasting a bunch of time with scheduling. I got to set up a scheduling system. Then you fix that problem. You wait for a problem to happen and then you fix it. In the beginning, maybe a year in or 6 months or at some point, then you can take a step back and optimize your systems. We'll talk about that in a later module. But in the beginning, you just start and then you see where the leaks are and you plug the leaks like a temporary plug. You're going to grow much faster and you're going to do a much better job with your patients because you're going to have the bandwidth to actually focus on patient care if you're not obsessing about all the stuff that's happening behind the scenes. Remember, nothing is more important than getting a patient in the door. So make decisions that are good enough. I just put 80%. That's what I think of it in my head. If you want to think 70%, I don't care what percent. But the idea is that in the beginning of a practice, there's a lot of little decisions you have to make. What scheduling system am I going to use? What should I set? What's the next book I should read? Should I see these kinds of patients? What EHR should I use? Even though I'm going to tell you all that stuff. But again, there's a lot of little decisions. Should I get an office or be video only? And if you're trying to make perfect decisions, you're going to get decision fatigue and you're going to be paralyzed. So just accept you're not going to be perfect right out of the gate. Your screening process isn't going to be perfect. Your documentation process isn't going to be perfect. Make it good enough. And then in 6 months, you optimize. Also remember, in private practice, and this is why I love private practice, all problems are solvable. Literally nothing is irreversible. Now, you want to be doing a good job with your patients. I'm not talking about practicing irresponsibly. But if you make a mistake with your screening process or a business system, or even with a patient, like because you're learning, it's all solvable. You can always, there's nothing that can't be reversed or changed. And also, you're the practitioner, you're the entrepreneur, you're your own manager, you're everyone in the business. And so you can create whatever systems work for you, as opposed to a job where there's going to be a bunch of bureaucracy and nonsense. So you have to, fill out this form or do all this ridiculous documentation that doesn't serve anyone. You don't have to do any of that. So don't get stressed by there being problems because you can solve them. And don't try to anticipate every problem. This is again that perfectionism of like, well, this might happen, so I have to make sure to put it in my intake form in advance. Now, I'm saving you a lot of time because I'm giving you my intake forms that took me several years to perfect. And you can obviously edit them based on your patient population and your needs. But my first intake forms were pretty basic. I don't even think I had intake forms in the very beginning, or like office policies. And it wasn't until I had a problem come up of like a disconnect of expectations that I was like, I got to put this in my intake form. And so don't try to anticipate every problem in advance because it will prevent you from just taking action. All right, that's the end of this video. These are just the basics of being an entrepreneur. We're going to be talking about these topics over time because there's a lot to learn, but I wanted you to at least have the fundamentals here, and I will see you in the next video.